Hey everyone, Bridget here at the AAFE Training Center. We are just treating my patient's submental area and her necklace lines with some twisted smooth threads. This is this patient's second treatment. I actually just saw her today for her third treatment and they are looking so much better than they did before. Those necklace lines have definitely filled out from some collagen stimulation. So we're really excited that she's getting some improvement. So for the submental area, as soon as I break through the tissue, I'm going to immediately level off my needle. Then you'll see as I continue to follow along this sunrise fashion, it all just kind of targets that double chin like pocket of tissue that a lot of people hate. And it's a great treatment for it, and I've seen really great results with it. For these threads, I'm using a 29 gauge by 40 millimeter twisted smooth thread. So basically I'm going to go all the way along and kind of point them all to that area that she can't stand. So once I have all of the threads that I'm going to do, I'm going to do 10 in her submental area, and then I'm going to do 10 on her neck for her necklace lines. So I will spin them 360 degrees. This just helps basically the threads to engage into the tissue. And then I'm going to go back in here because sometimes if you leave them all in and you go in the opposite direction, you'll kind of get caught on those needles that are already in the tissue. So I'm going to 360 spin these, and then as well put some light pressure as I pull out, and then that is that for her submental area. For smooth threads or twisted threads, either one, I will topically numb just because I think it is a little pinchy for patients, especially on the neck. I think a lot of people don't tolerate it well. So I usually numb for about, I'd say 15 to 20 minutes to make sure it really sets in. I do a nice thicker layer, and it seems to really help this patient. And she likes to say that she doesn't have pain tolerance. So, and she says that it really, really helps her. So I'm basically for the necklace lines just going to like follow along the deficit. So you can do a couple of different things. Wherever you place the threads, it's going to help because it's still going to stimulate collagen. I think going into the necklace line, it has always given me my best result. However, you can also kind of go above and below the deficit, which will kind of make a sandwich, and then it will kind of give you double collagen stimulation around the necklace line. Her necklace lines are pretty faint at baseline, so I didn't think she would require that. So I just decided to go directly into the necklace line. But as you can see, I'm just continuing to follow along here, and I will make sure to spin 360 degrees and then withdraw all of my threads. Obviously, this patient was cleaned prior, and then after I like to wipe everything with alcohol again, just to get one, all the marker off, and two, just to keep everything nice and clean. So she will be back for her third treatment, which was today. So then after that, it'll just be maintenance. So usually I say every 6 to 12 months, depending when the patient wants to come back. So thanks so much. If you're interested, reach out.